Welcome to Black Health, a weekly talk show discussing medical issues impacting and afflicting South Florida's Black community. Now introducing our host, Dr. Michelle Kirwan Bythewood.
In a fast-paced world where every moment counts, finding time for self-care and health can be a challenge. But fear not, I know of a sanctuary tailored just for you. Join us as we explore a one-stop wellness and healthcare center that caters specifically to the needs of women with busy lives. Discover the secrets to maintaining your well-being, achieving balance, and reclaiming your vitality, all under one roof. Thank you so much for joining me today, and welcome to Black Health, a platform to discuss illnesses affecting the Black community. I am your host, Dr. Michelle Kirwan Bythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. And today we are talking with Dr. Laura Martin about the University of Miami's new one-stop wellness program and about Dr. Martin's field of urogynecology. Dr. Martin completed her medical degree at Nova Southeastern College of Osteopathic Medicine. She completed her obstetrics and gynecology training at Einstein Medical Center, Philadelphia, and her urogynecology fellowship at Cleveland Clinic in Florida. Dr. Martin, it is a pleasure to have you on Black Health today. Thank you for joining us.
Thank you so much, Dr. Kirwan. It's a pleasure to be here.
Thank you. Sorry?
Oh, I was just going to start to tell you about the programming. So the programming is actually something that we started at University of Miami. And we started this program initially back before the pandemic hit us. And because of the pandemic, we had to put a pause on it. And now it finally came to fruition. So we're very excited about this program. It's called the Comprehensive Women's Health Alliance. And it's a program that allows us to give easier access to physician schedules in certain subspecialties that women highly utilize. So there are multiple different subspecialties, but what happens is when you connect with our nurse navigators, we have 2 dedicated nurses that will help you navigate the system to get those appointments that you need in a timely manner and get your health back on track.
Awesome. So when did you say it was launched?
So we launched in late July, and we had our first major advertising start in August.
Okay. So what is your role at the Wellness Center?
So I am the co-director of the Wellness Center, and I take care of everything as far as, what initiatives we have, who we actually utilize, which different departments we recruit to help us take care of women. And I advise them on all the health aspects of this program.
So I know this is sort of advertised as something for women with busy lives, and it's one stop. So what makes it one stop for women?
Yes, so we have a website that women can go to. And once you access that website, there is an intake form. When that intake form is filled out, it goes to one of our 2 nurse navigators, and they contact you directly. There is also another avenue. You can also call one of the nurse navigators, and they will speak to you directly on the phone. Or you can get an internal referral from a UHealth provider into the program, and the nurse coordinator will contact you as well. And once they make that contact with you, they're able to help you prioritize what appointments you need first and which ones are more important for a little bit more acute issues that you might have versus your health maintenance issues. And they can help you and guide you through getting access to all those different departments. So that's why it's a one-stop shop and makes it easy for women to navigate their busy schedules. And as we know, women are the cornerstone of families often are there to help coordinate other people getting connected with healthcare providers. So this is our chance to help them.
That's awesome. I love this idea. I actually get my own healthcare at University of Miami, so I will definitely be looking into this program. I am a woman with a busy life, and it will be wonderful to have it. Almost is like having a personal assistant for your healthcare. That's kind of what it feels like. So I think it's a great concept. So what specialties are included in the program, and what happens if I need, for example, a specialist that are not included in your program?
Yeah, so that's a great question. So obviously, we can't include every single specialty that we have at University of Miami, but we try to hit the ones that are highly utilized by women. So primary care, gynecology, dermatology, bone health, radiologic imaging, cardiology, just to name a few, are the ones that we have been in coordination with to help women.
So when I think of this, I think of women maybe, with busy lives. So
Mhm.
I'm thinking, 30s, 40s, 50s, but maybe women in their 20s have busy lives or elderly women have busy lives. So what are the age groups what age groups do you see?
Do we involve? Yes. So we think it's important that women of all ages have good access to the healthcare system. And to assist that, we actually start at age 18. So after
Mhm.
you end your pediatric, visits with your pediatrician, and you're transitioning over to visits with a primary care physician, we welcome anyone 18 and over into the program. And we actually have different focuses for each of the different age groups. So 18 to
Mm.
40, we have a focus on contraception and STD testing for those patients, and general wellness, and seeing their primary care provider. And then 40 to 50, you start your mammogram. So we have a focus on perimenopausal changes, making sure that you get your mammograms, keeping up with anything new that might be coming up, like maybe you need to look at some risk factors that exposures that your family may have had, whether that be a history of colon cancer in the family, you need to see a gastroenterologist. We start looking at those risk factors from 40 to 50, and then 50 and over. You're mostly in your menopausal stage, and therefore we offer menopausal care for those patients, as well as general health maintenance. And of course, the need for cardiology, dermatology, all those things start to increase after age 50.
And then since you're a major hospital system, I presume, then I could get my colonoscopy done there, my mammogram done there, any bone density or scans done there, all my labs done there. How about pharmacy?
So pharmacy is separate. We don't have any pharmacological services at University of Miami aside from when you're in the hospital and being discharged. So the we just coordinate with whatever your local pharmacy would be. But yes, we do help you coordinate any health maintenance. So you whatever you need for to maintain your general health, like your annual exams, your mammograms, your colonoscopies, DEXA scans, things like that. Those are all a part of the women's health program.
So from what you're saying, my understanding is I call, I get a nurse navigator, and the nurse navigator, I guess, takes a history of what all my issues might be, what concerns I have, and from there she helps coordinate my care amongst the various specialties and any other services that I might need.
Yeah, so they'll start with your request first. When you connect with the nurse navigator, if you've filled out the form already, then you've already indicated what services you're interested in. And then
Mhm.
after that time, they do screenings to make sure that you have all the services that you need. You're not missing anything.
Okay. All right, great. Well, Dr. Martin, we need to take a quick commercial break. So don't go too far. We will be right back to continue this transformative journey towards a healthier and happier you. Well,
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
Are you a business owner interested in import-export opportunities? Register now for the Florida International Trade and Cultural Expo, or FITSE, October 4th and 5th at the Broward County Convention Center. At FITSE, you can engage buyers and sellers from over 60 countries, explore the World Expo marketplace, and network with global leaders, trade experts, and surprise guests. Free to attend. Visit fitcexpo.com or call 954-357-6400.
My Miami, it's a one-of-a-kind combination of bold, vibrant art that's made to be free, to go on stages, walls, or become them. It all leads me to a world filled with warm waters and extraordinary trails. This is when I'm at my best, when I'm embracing my art venturous side. This is my Miami. What's yours?
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
When quality care is a priority.
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
Welcome back to Black Health. I am here with Dr. Laura Martin. We're talking about the University of Miami's one-stop wellness program where self-care meets convenience. We are also talking about Dr. Martin's field of urogynecology. So tell us what that is, Dr. Martin, and how does this differ from a regular gynecologist or a urologist?
Yes, so urogynecology is a subspecialty of gynecology, and we focus on pelvic floor medicine. It's also a surgical subspecialty, so we also are heavily surgical and procedural in the office. And it focuses on mostly pelvic floor disorders such as urinary incontinence, prolapse, fistulas, and pelvic pain.
Okay. And you said it's a surgical specialty. So you spend time in the OR doing surgeries, pelvic floor type surgeries?
Yes, I would say probably almost about 40% of my time is in the operating room. And then about 60% of my time is in the office. Because a lot of the interventions that are needed for the pelvic floor, after the conservative measures like pelvic floor therapy and medications, then require surgery. So it is a surgical subspecialty.
So I know this is kind of a very general question for probably something that's not so general, but I feel I need a gynecologist. I might have a little fear just from that title, like, what are they going to do? So what does a basic urogynecology exam look like?
Yeah, so that's an important question because the urogynecology exam is a little bit more thorough and in depth than a regular gynecology exam. Usually what women will experience in a gynecology office is just utilization of a device called a speculum where they look inside and then make sure that everything looks healthy inside the vaginal area. For urogynecologists, we actually do an evaluation of our pelvic organs. So we're looking at the vaginal area as well as all the muscles of the pelvic floor. And sometimes we may empty the bladder utilizing a catheter or do a bladder scan and also potentially a rectal exam as well.
Sounds like fun.
Yes.
Sounds like my fears might be more into it. I'm just kidding.
It takes a couple of minutes and then we get the information that we need to help the patient.
Okay, not bad then. So let's talk about some of the things that you see. You mentioned vaginal floor. What is pelvic organ collapse, and what are the different prolapse? I'm sorry, and what are the different types of prolapse that exist or that you might treat?
Yeah, so pelvic organ prolapse is a weakening of the vaginal tissues. And when the vagina weakens, it allows the other organs to fall into it. So it's essentially a hernia, a herniation of the pelvic floor organs through the vagina. So there's different types, and essentially what we're looking at is the front of the vagina, the top of the vagina, and the back wall of the vagina. So you can have weakening on all of those areas or just one. And that's part of the exam. We'll have a look and see which area is affecting you. And patients often will feel a pressure-like sensation that can be very bothersome. Occasionally, patients will have no symptoms at all.
Okay, so it might be just caught on a routine exam if they have no symptoms at all.
Correct, yes.
Okay, so let's talk specifically about vaginal prolapse. What causes that, and are the symptoms what you just mentioned, same as what you just mentioned?
Yes. So the number one risk factor is going to be childbirth, especially with an operative delivery such as forceps. That increases the risk for women. Family history of having somebody like your mother or your sister having had prolapse increases your risk, as well as chronic bearing down. If you have chronic constipation, chronic cough, anything that's going to put chronic stress or pressure on the pelvic floor, lifting very heavy things like moving furniture can also affect pelvic organ prolapse. And also menopause. As we go through menopause, the vaginal tissues and the collagen changes and it weakens. And that's when we usually see prolapse presenting. And again, these patients will present with pelvic pressure and some discomfort in the pelvic area.
So is there anything that women can do to prevent this from happening to them?
Yeah, so your pelvic floor exercise or Kegels, squeezing the pelvic muscle is the number one way to help prevent it. If the tissues are weakened due to menopause, or if you have a family history, it can be a challenge. But the pelvic floor exercise or physical therapy is a great way to help prevent pelvic organ prolapse.
So should all women start doing Kegel exercises at some point in their life? And if so, how often? Is this something you do once a day, 10 counts, or what do you recommend?
Yes, well, as a urogynecologist, I think everybody should be doing their Kegel exercises. And you can start, at an early age, as early as 18 years old, if you like, just to maintain the pelvic floor health. And you can do your pelvic floor exercises 3 times a day. And I tell patients to do 30 each time, so a total of 90 per day.
Wow, I didn't realize it was that much. So what are the treatment options specifically for vaginal prolapse?
So the treatment options include the pelvic floor therapy or Kegels, like we just discussed. You can also wear a pessary, which is a silicone ring that goes inside the vagina, and it acts as a mechanical device to help hold up the prolapse. And then the other options on the market include some vaginal devices that are similar to the pessary that can go inside the vagina to hold up the prolapse. But those are more for temporary use, maybe daily use. And then the last option is surgical. So there's many different options as approaches to surgery, but surgery is an option for patients with prolapse as well.
And what is the success rate like? Is this something that recurs, or once you've, for example, had surgery, is this curative?
So there's no complete cure. We generally quote patients about a 15 to 20% risk of prolapse coming back after surgery. And these numbers are estimated based on patients who are mostly over 65 years of age. So if you're younger with pelvic organ prolapse, then that number is probably higher. But it also depends on the type of surgery that you have. If the surgery is done with your own tissues, the tissues already have some laxity and weakness. So that's where we get that 15 to 20% risk of the prolapse coming back. And if we do an abdominal mesh placement, a surgery called the sacrocolpopexy, the number goes down to about 5 to 10% risk of the prolapse coming back.
And what age of women do you typically see this in? Is this older women, or any woman who's maybe hadn't given birth before?
Yes, generally we see it in patients who are over 60 years of age, but it can happen earlier than that.
Okay. So we're going to switch gears a little bit and talk about another thing that you treat as a urogynecologist, urinary incontinence. Tell us what that is.
Yes, so urinary incontinence is the inability to hold urine, either prior to getting to the bathroom or with Valsalva movements like coughing, sneezing, and bearing down. So any urinary leakage is considered to be incontinence and considered to be abnormal. So there are treatments for this, the treatments are focused on which characteristic of the incontinence you have. And usually we focus mostly on the inability to get to the bathroom on time versus the coughing, sneezing, laughing, leaking.
Okay. And what age group is this typically? I mean, I think this happens to pretty much everybody at some point in time, but what age do you typically see this maybe become a problem?
Yes, so it's very common and does increase with age. There's some numbers quoting 80% of patients over 80 years old will end up having some type of incontinence. It can start as early as 21 years old, but I would say average age is going to be over 40.
And the cause of this, I presume, is pelvic floor weakening?
So it is
Or is
considered
this more a bladder muscle weakening?
Yeah, so it's still considered a pelvic floor dysfunction. But when you have issues trying to get to the restroom on time and you can't quite make it there, that's usually due to what we call detrusor overactivity. It's just the bladder is contracting before you can get to the bathroom on time. And then when we look at the coughing, sneezing, laughing, leaking, that's a weakness in the periurethral tissue around the urethra where the urine comes out, and a decrease in the strength of that muscle of the urethra where the urine comes out as well. So that's why we treat those two types of incontinence differently and have different approaches to them.
Okay. Dr. Martin, we need to take another quick commercial break. You are watching Black Health. We are here with Dr. Martin, and we are currently talking about the field of urogynecology. We will be right back.
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Are you a business owner interested in import-export opportunities? Register now for the Florida International Trade and Cultural Expo, or FITSE, October 4th and 5th at the Broward County Convention Center. At FITSE, you can engage buyers and sellers from over 60 countries, explore the World Expo marketplace, and network with global leaders, trade experts, and surprise guests. Free to attend. Visit fitcexpo.com or call 954-357-6400.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
My Miami is a serene getaway of kicking, swinging, grunting, swimming, spinning, and steaming. It's my special place I can only find in this special place. I call this endorphin-inducing retreat my fitnesscape. This is my Miami. What's yours?
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
Welcome back. You're watching Black Health. We are with Dr. Laura Martin, and we are talking about her field of urogynecology. But I think we can end on that note as we're out of time. Very good advice. I always tell the parents of my patients, as I'm a pediatrician, that it's always best to just go and ask the questions. It doesn't mean you have to start any medications. It doesn't mean you have to have any surgeries, but it is always advisable to just find out what your options are and weigh all of those choices and then move forward from there. Dr. Martin, thank you so much for your time today. It's been a pleasure having you here today on Black Health. Thank you for all of your knowledge and your expertise. I'm sure we will see you again in the future, hopefully here on Black Health again. And if somebody wants to find you, how do they reach out to you at the University of Miami?
Thank you, Dr. Kirwan. So you can just call the general line for University of Miami and ask for Dr. Martin. You can reach me that way. Nice and easy.
Awesome. Thank you so much again, Dr. Martin. Thank you, all of you out there watching us and joining us today on Black Health, and we will see you again next time.